CVS Health says it's investing $20 billion over the next decade to elevate the customer experience. Kristen Scholler spoke with Talik Mandati, the company's EVP of Ventures and Chief Experience and Technology Officer, more about this initiative. Check it out.
Experience is one part of it, Kristen. I think we are imagining the entire healthcare, changing the experience from being sporadic and completely siloed to an integrated experience that's customer focused, expanding the access to healthcare to patients and consumers, giving full transparency to the cost of healthcare and the ability to manage the cost, and then making sure they get the right outcomes by picking the right doctor, right facility, and getting the advice that they need. So all those things are part of how we are transforming healthcare.
What does the data show about the link between customer experience and health outcome?
Good experience, good healthcare experience leads to people engaging in their health more. And engaging in their health more leads to better trust and behaviors. And it's clear from the data, when people engage in their health sooner than later, more frequently than not, they have much better outcomes, much better longevity and better health. So data is very clear about that. It all starts with the experience.
CVS Health has committed $20 billion over the next decade to improve the patient experience. How is it going to deploy that money?
When we looked at customer experience or patient experience, clearly how the patient engages with CVS Health and how they navigate the healthcare ecosystem, that's really important. Second, equally important, is eliminating the friction between the providers and the rest of the healthcare ecosystem. So the providers can provide better experience to the consumer or the patient. And third, as a company, just operating more efficiently and more agile. All those three things are important. And our $20 billion is going towards the experience, the eliminating provider friction, and being a more lean and agile company. We invest that money, or we intend to invest that money in two different ways. One is developing capabilities that go against the three I talked about. Also investing in the digital health ecosystem. So we have CVS Health Ventures, and we intend to invest a lot of money every year into the ventures ecosystem as well.
I want to hear more, Talik, about how AI and digital innovation fit into the strategy at CVS Health.
Healthcare as an industry, I'm a relative outsider. I've been here in healthcare for 3 years. Healthcare as an industry has very successfully and consistently resisted change and transformation and technology or the past many decades. And so healthcare as an industry is well behind other industries like financial or entertainment in adopting technology and getting better because of it. AI, I think, is a truly once-in-a-generation phenomenon for healthcare. It reminds me of, third world was not well connected when it is wired telecom, right? Copper was too expensive for the third world. When cellular came on into vogue, the third world really leaped forward the developed world in being connected. I think that's what AI is going to do to healthcare. Healthcare is going to leapfrog the other industries in getting transformed with technology, and AI is going to do that. I think AI is going to change the access to healthcare paradigm by expanding access to people and allowing folks like pharmacists to operate at the top of their license. AI is going to allow cost management and transparency AI is going to make the experience a lot more coordinated. So we are really bullish about the impact of AI.
2025 this year has brought a lot of change. How is CVS Health working with the White House to reach its goals?
We were very excited to pledge to be a part of the pledge to CMS on a variety of things: app, kill the clipboard, interoperability, payer commitments to reduce provider friction. We were happy to pledge to all of those with the CMS. And interestingly, we didn't have to change any of our roadmaps because that work was already part of what we were planning on doing. So we are in a good shape to achieve those pledges. And I want to say, look, healthcare is an industry where the administration plays an incredibly important role, and the partnership between private and public sector is incredibly important, and we are glad to be part of that.
What are the ways that consumers can digitally engage with CVS Health now for better access?
We think of experience as omni-channel. So whether you go to the store, whether you pick up the phone and call, whether you access digitally, the experience should be the same. The experience should be completely integrated. The experience should be proactive. And the experience should be actually enjoyable, which hasn't been the case in healthcare in a long time. But it all starts with digital. So our app, as an example, by the end of this year, there will be complete integration between Caremark, which is the pharmacy benefits provider, Aetna, medical insurance provider, CVS Pharmacy, which is a retail, specialty, and mail order pharmacy, and our Oak Street and Minute Clinic clinical aspects. All of them would be completely integrated in the app. So the consumer, when they open the app is for them. It doesn't reflect the different stakeholders of healthcare. It reflects the needs, the preferences of the consumer. And consumer at that point, using AI-based search, just asks, I'm getting hip surgery. I want it to be scheduled. And everything to do with that will be scheduled. So we are really bullish about that integrated experience that's consumer-centric and that's in civilian language. It's natural language. We are very excited about that.
Well, the fall is upon us, Tilak. What is CVS Health's message to keep patients healthy this season?
The first macro thing I would say is engage with your health and take advantage of the app, take advantage of the store channels, talk to the pharmacist, engage with your own health. That's very important. And then I cannot emphasize, obviously, immunizations as we go into the winter season are important. And CVS Pharmacy Store is a great place to get your immunizations.
Thanks to Tilak Mandadi and Kristen Scholler for that interview. In just a moment.